Hey there, this is Dr. Evan Osar, founder of Fitness Education Seminars, the movement-based solution to the healthcare crisis, and author of the Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. Thank you so much for tuning into this webinar. If you were at this 2013 Fitness Business Summit in Louisville, Kentucky this past weekend, I would like to thank you for allowing me to share this all-important topic with you, and here's the webinar I promised you. If you weren't at the event, here's the webinar on my presentation, Program Design Considerations for Real People. Because the majority of us deal with the general population, we need strategies that work with real people that have postural issues, muscle imbalances, and chronic tightness or discomfort. And if you do work with athletes, I'll discuss how the strategy we cover during this webinar can also help your athletes perform at an optimal level. So here are the three things I want you to get out of this presentation. Number one, efficient movement strategies. Understand why helping your clients develop a more efficient postural movement strategy is so important to their overall ability to perform during exercise, sport, or real life. 2. Corrective exercise strategy. Demonstrate how helping your clients develop optimal breathing patterns is the first and most important step in helping them develop a strategy for optimal movement. And 3. Program design strategy. Understand how to implement breathing into your program design, whether you train one-on-one or in the group setting. Why is this topic so important? Because we have a healthcare crisis and we need leaders. And I believe that you, the fitness professional, are the movement-based solution to the healthcare crisis. So let's get started. With all the information on program design that is out there, what can I add to this topic? Well, for starters, let's discuss an important concept regarding our general population clientele. And let me ask you a question. Why do your clients get tight? Why do they develop postural issues and chronic muscle imbalances? Well, if we think of all the reasons, lifestyle is one of the biggest things that comes up. We know that stress is a big component to why our clients get tight. But why else does the nervous system decide to tighten down muscles, especially those muscles that chronically get tight and remain tight despite trying all types of strategies like stretching, massage, foam rolling, and other interventions? Well, if we think about walking on a slippery surface, whether it be a slippery store surface or walking on ice, what's your body's natural reaction? Would you walk with tall, long strides, confident strides with a nice, long, tall, wide posture? Or do you tend to walk slower, more controlled, more cautious, with more flexion and adduction in your limbs? And we know that's the nervous system's reaction to walking in an unstable or unpredictable environment. So when we start to look at our client's posture, like my client here pictured in the middle image, we see that this strategy is really a strategy to improve this individual's level of control, to create a more stable or controlled environment. And we know that the majority of the reasons that these clients develop those strategies and resultant muscle imbalances, chronic tightnesses, and musculoskeletal pain is because of these altered strategies. So what this client is really trying to tell us is that my strategy for control is non-optimal. Please help me develop a better strategy. And then if we look at the client to the right, the far right, this is a patient that presented to me with chronic headaches and shoulder pain. She was a very active individual. And her posture, even though it looks overall better than the gentleman in the middle, is actually non-optimal as well. And if you look, you can see that she has a long lordosis. She has a lordosis all the way from her lower spine all the way up through her upper back towards her neck. So she's got overextension in her thoracic spine. And we'll talk about why this becomes so important. And if you're watching this webinar, just sit up nice and tall in your chair and lift up your chest and pull your shoulder blades down and back. Now take a deep breath in. What do you find that happens? You find that the breath goes a couple places. One, it can go into your abdomen. So if you're a good breather, it can go into your abdomen. And two, you'll really notice it goes into your neck and chest. And these clients that present with this posture, and we're seeing more and more of these individuals, like this client here to the right, far right, with this long lordosis or this hyperextension in the thoracic spine, they functionally lock up their thorax and they inhibit their breathing, so therefore they inhibit the ability to get optimal control. So what we're trying to say here is that our clients develop tightnesses as a way to develop more optimal control. If we want to change this chronic tightness and these muscle imbalances, which impact their posture as well as their movement, then we have to change how these clients are developing their control. So when we talk about control, we're also going to talk about strategy, because a client's control is also their strategy for control. And if you look at my little niece here, so cute, we see her in a plank position. We see this individual down below also in a plank position. Which one of them looks like their strategy for control is more optimal? And again, although my niece is only 3 months in this picture, you can see that she has much more control and a much more efficient strategy for stabilizing herself in the plank position. You see the nice long spine position, and you see the nice ability to control her core or her thorax over top her pelvis, the thoracopelvic canister, as we'll talk about in a minute. And this client down here in the bottom image looks like a lot of our clients performing plank or push-up type positions. Head is jutted out, hyperextension in the neck, flexion of the thoracic spine, and hyperextension at the lower lumbar spine. And we know that this is a non-optimal strategy for control. And this is the client that presents to us with chronic postural and movement issues as well as chronic muscle imbalances. And they're presenting to us to have us help them achieve their health and fitness goals. But what about professional athletes? We also see difference in strategies in these individuals as well. And if you look at two high-level tennis players, we look at Roger Federer on the right, and we look at Rafael Nadal on the left. Both of them just hitting easy forehand shots. Which one of these individuals, both high-level athletes, both very effective at what they do, don't think about how effective they are, whether they win or lose, but let's look at their strategy. Which one of these individuals looks more efficient hitting their forehand shot? If you look at Rafael Nadal, you'll see he has very little thoracic motion and a whole lot of shoulder motion. You also notice that the knee wraps below his knees. Now look at Roger Federer. If you look at his overall alignment, if you were to drop a straight line down, you'd see that his head is over top his trunk is over top his pelvis, and his pelvis is lined up over top his lower extremity. He's got very efficient strategy for trunk rotation and arm motion. Again, he's using his entire kinetic chain through the core and down through his lower extremity to perform this action. Whereas Nadal performs this action very effectively, but very inefficiently, using only an arm strategy. And this, again, goes back to why, if you look at the injury rate between these two athletes, Nadal has many more injuries. Again, if we're looking at efficiency versus just being merely effective. So again, even at the high level, even high-level athletes and our clients that perform at a high level can develop inefficient patterns. So what's the greatest problem with inefficiency? So we see these clients, so what? What's the problem? Here's a client of mine that's a very active individual, has never lifted a weight in his life. Why does he have such overdeveloped thoracic erectors, thoracolumbar erectors? Look at the tone in his low back. Why does he develop such overdeveloped erectors when he's never lifted a weight in his life? Well, let's look at his strategy for standing on one leg. And he has pain when he stands or walks for long periods of time. Look at the strategy. Look at the amount of effort he's got to use to stand on one leg. Do we need that much musculoskeletal effort or that much muscular effort just to stand on one leg? And we know the answer is no. When we perform activities like standing, sitting, walking, we want to use low-level strategies. We want to use efficient strategies that we don't have to use an excessive amount of musculoskeletal force to control that position or that posture or that activity. And you can see that this individual, like many of our individuals with chronic postural and movement dysfunction, are using high-level strategies for low-level tasks, like I said, for sitting, standing, walking, and then they take that into their workouts. And that's where our clients start breaking down. So what we want to do is help these individuals develop a more efficient strategy for posture as well as movement, so then they can carry that into their exercise as well as their movements for everyday life. So other signs of inefficient strategies are shown here. We see many of our clients, and sometimes we become part of the problem when we teach our clients to hyperextend at their low back. And we see this client who's performing lat pull downs, and we see this pattern often with overhead presses. We see this pattern with chin-ups and pull-ups. We see this pattern with squatting and lunging, where the client lifts their chest up, pulls their shoulder blades down and back, and creates this thoracolumbar hinge. And you see the arrow pointing to that area right there. And you see this also in my patient over here who works with a personal trainer and also does yoga for his chronic tightness. You see this extension, excessive extension at the thoracolumbar junction, and this flexion in the lumbar spine. And again, he's stuck in a posterior tilt, and as is this individual in the image to the left. Again, even though it looks like he's hyperextended at this, or he is hyperextended at this thoracolumbar junction, he's actually also in a posterior pelvic tilt. And that's what creates the need to have hyperextension at the thoracolumbar junction. They're trying to create compensations. And most of our clients that are presenting to us that sit for a living, this is their posture. Even though we don't look at our clients with their clothes off very often, this is what they're presenting with. This hyperextension at the TL junction, the thoracolumbar junction, and the flexion of the lumbar spine. And this is why they're developing chronic low back tightness, unstable cores, and chronic hip tightness patterns. So the tightness creates a lack of optimal control. So when our clients are tight, as we said, it signifies that they have a lack of optimal control. The lack of optimal control then leads into these inefficient posture and movement patterns. And the inefficient posture and movement patterns then leads to our client's dysfunction. And where the weak link in their kinetic chain is, that's where they have the problems. So if they have a weak link in their neck, they'll develop neck and or shoulder problems. If they have a weak link in their low back, they'll develop low back problems. If they have a weak link in their knee, they'll start to develop knee problems. So this cycle just perpetuates over and over again until we change their strategy. So this webinar is really about how do we change our client strategy so it's more efficient so they can get out of this chronic cycle of dysfunction. So how do you help your client develop a more efficient strategy? Well, we use a simple concept, the ABC principles. A, alignment. We help our clients develop more optimal alignment so the joints can be loaded in the most efficient manner possible. Then we teach our clients how to breathe. So the ABC, A is alignment, B is breathing. We teach our client how to breathe so that they can maintain optimal alignment as well as be able to maintain, achieve and maintain optimal control. And C is control. We develop the proper alignment, partner it with breathing, and then we teach them how to control it through the fundamental movement patterns of pushing, pulling, squatting, lunging, bending, rotating, and gait. That's how we help our clients develop more efficient stabilization and movement strategy so they can achieve their health and fitness goals while minimizing the risks for injury. So when we talk about developing a more efficient strategy, we want to look specifically at the thoracopelvic canister. And when we talk about the thoracopelvic canister, we're talking about a functional canister that's formed by the thorax, which is the rib cage and the thoracic spine, sitting over top the pelvis. So this forms a functional canister, or what we often call in the industry, the core. The ability to control our body lies with the ability to control the thoracopelvic canister, because when we have optimal control of the thoracopelvic canister, we can develop optimal efficiency. And you look at the picture of my niece here, and this is a very common child development position. So here she is at 3 months, developing the ability to be long through her spine, to line up her head over top her trunk and over top her pelvis, to create proper centration or centering and alignment of her hips and her shoulders, and then developing the optimal intra-abdominal pressure and intrathoracic pressure that she needs to stabilize and control this alignment, as well as control the movement of her extremities. And we can use very many of these patterns and strategies that the child develops to improve function in our clients. You'll see the same similar type pattern in my client above, and we take this same position and the same control into the fundamental movement patterns like squatting. I'll show you guys how to do that. So why is breathing so important? Breathing is important because it sets up optimal control. We develop optimal intra-abdominal and intrathoracic control by breathing right. We need to create three-dimensional breathing so that our clients have the ability to set up optimal stabilization. When we have stabilization, we have control, and now we don't have to compensate by over gripping or over tightening other muscles. And those clients I showed you earlier that had the chronic tightness or gripping type patterns, they do not have optimal control patterns. And that's what we said is why our clients get so chronically tight. So if we can teach them how to breathe right, we set up a more efficient strategy for stabilization, therefore control, and now we can start to move with greater ease and efficiency. So how do we set up optimal efficiency of breathing? We have to get our clients to start breathing optimally and three-dimensionally breathing. So first, for our clients that are primarily chest breathers, just get them breathing more down into their abdomen. So we want to first start by making sure that they can breathe and we feel expansion all the way down below their belly button, which signifies they're getting optimal control and breath of their diaphragm as well as the pelvic floor. We use this position here with the legs elevated for the majority of our clients because, again, it lines up the client's head over top the trunk and the trunk over top the pelvis. It lines up the pelvic floor lines up the diaphragm, and it lines up the thoracic inlet. So these three diaphragms are aligned, so we have optimal pressure control. And when we have optimal pressure control, we have optimal control of the entire system. Then we can start to let go of those chronic tightnesses around the hips and the shoulders as well as the neck, because the body doesn't have to compensate for inefficient strategies. Next, after abdominal breathing, we want to go lateral or side to side. And again, if our clients are chronic abdominal grippers, they're over gripping their abdominal wall. Like many of us do as fitness professionals, we walk around with too much tone in our abdominals, or we walk around with too much tone, or we have that thoracolumbar extension, or even that thoracic extension as we saw earlier. We start to grip down our thorax. That's why these clients are presented with so much thoracic rigidity, because they're using their muscles to hold their trunk solid. That's what starts to lead into these inefficient breathing strategies. That along with stress, and now our clients have dysfunctional breathing, so therefore they have dysfunctional control. So if we can start to get the client to open up their thorax and start to relax their muscles, and you can do this through breathing. We can facilitate more thoracic mobility as well by all the techniques you already know how to use. The foam roll, manual therapy techniques, general mobilizations. But again, you can use breathing, and you should use breathing as a very effective way to also encourage proper thoracic and rib cage mobility. And then once we get abdominal and lateral breath, we need to have the client to breathe front to back, or to open up that posterior aspect of the diaphragm. And again, we talked about how the diaphragm fascially blends with the quadratus lumborum, the transverse abdominis, and the psoas. And if we think of three muscles that often become dysfunctional in our clients, we can think of the transverse abdominis, often inhibited, psoas, often inhibited, QL, often overactive, and the deeper fibers are often inhibited. Again, these are all fascially blend with the diaphragm, and when you're not breathing, or clients are not breathing well, then we're not getting optimal stabilization, especially at the thoracolumbar junction, and that's why these clients are creating so much thoracolumbar extension and creating these compensatory patterns for stabilization. So again, we need the client to start to open up front to back as well as side to side. And again, we can use tactile cues as we did during the presentation. And if you want more cues on how to improve breathing and get that front to back or that posterior lateral breathing, feel free to check out any of our free videos on breathing at www.fitnesseducationseminars.com and go to the free video section, and we have plenty of free videos to show you how to get that three-dimensional type breathing. Once you learn, and once you teach your client how to develop optimal breathing strategies, then you must teach them how to take it into their fundamental workout and their movement patterns, like squatting, lunging, bending, rotating, pushing, and pulling. So again, we teach a client how to align their spine, their head over top the trunk, trunk over top the pelvis, and then we teach them how to breathe in this position. So we can use this as a supported squat type position and have them breathe in this position, have them start to relax, teach them how to centrate those hips and sit back in those hips, and how to dissociate through their shoulders as well. And again, we want to take this into all the fundamental positions and movement patterns you guys are already doing with your clients, like the plank position, modified side plank position, or a single leg deadlift, for example. But again, the concept remains: keep the spine long, teach a client how to align the head over top the thorax, thorax over top the pelvis, and maintain that lower extremity alignment, and how to sit through that hip. And again, when you teach your client the proper progressions, they start moving more efficiently. They stop having so much chronic pain, they stop having so much chronic discomfort and gripping, and they start to move more efficiently, and then they start to be able to accomplish their health and fitness goals in a more optimal manner. And that's how you start to really make powerful changes in your clients. For some of our clients, one of the most important strategies you can give them is just to teach them how to turn their muscles off, and how to not use their muscles so chronically in a gripping type fashion. And here's a client of mine, a former gymnast, very active female who had chronic low back pain. You can see here how she's a chronic abdominal gripping. She's pulling her abs in, so she's got overactivity of the external obliques and the internal obliques, as well as the rectus abdominis. She's pulling herself into a posterior pelvic tilt, and she also has posterior hip gripping or butt gripping. So that again, she flattens out her lumbar spine, she goes into a posterior pelvic tilt, and she also more importantly, she functionally locks down her thorax by this over gripping of the abdominal wall as well as the low back erectors. And we saw examples of that in our earlier patients and clients as well. When the clients don't let muscles go, you can't help them develop more efficient breathing and or alignment issues. So in this picture here, to the right, I'm teaching her how to let go and giving her a cue, both kinesthetically as well as I have her think about floating her spine over top her base of support or her feet, or to think about lengthening through her back and relaxing her abdominal walls, relaxing her rib cage, and then breathing in that position to encourage this optimal alignment. Because many of our clients that have what we call instabilities or lack of optimal control, they're gripping to create stability. So for those clients, one of the most important strategies we can give them is to teach them how to let go, how to let go of that chronic gripping when they don't need that over contraction. Now, how effective can this be? Here's a client of mine, a competitive cyclist who presented with just general tightness and just a lack of performance. He didn't really have any discomfort. He just had a lack of performance and he wanted to improve his efficiency in his bike stroke. Here's 15 minutes of breathing. I was able to take him and get him out of that chronic low back tightness. And that, see that little hump right there, that little buckle right there? We call it a buckle in the low back because of overcompression here, and he buckles through his low back. 15 minutes of breathing, and we're able to, in teaching him just how to let go of his muscles and to create more length through his spine. And that's translated into a more efficient pedal stroke for this cyclist. How about an older client? Here's a 70-year-old client that my wife worked with using these same principles. She was complaining about her pooch belly. And you see in the image to the left, she's got sort of a pooch belly and that sort of kyphotic posture we see in many of our older clients. Again, with just a little bit of soft tissue work and just a little bit of breathing in the prone position we have on our website in the free video sections, you can see the dramatic change in her abdominal wall tone and her ability to stand tall. And this is with no cueing. All we told her to do is breathe three-dimensionally and think about being long. And you see the dramatic changes in a 70-year-old client. And does this strategy also work with athletes? Here's an image of one of our good friends and colleagues, Chris, who just graduated from the Integrative Movement Specialist Certification Program. He works with several professional hockey players, and he's been so effective at using these concepts and principles, especially breathing with his athletes. He's picked up more professional athletes, and he's been interviewed by the strength and conditioning coach for the athletes that he works with, because he wanted to know what Chris is doing that's so effective in making a change in his athletes. So he's been able to share that information with the entire team and the strength coach of this professional hockey team. So again, we see that not only can it help our general population clients and be effective at that level, but Chris is showing how he's successfully using the same principles and concepts with the professional athletes. So again, these concepts seamlessly blend with whatever clientele you are working with because they're based upon the principles. So how do you incorporate this into a program design? Well, in the beginning, you can just help your clients self-assess. So you can do a very simple posture assessment. So have your client lie down on the floor or up against a wall and just get a sense of where their body is. Where do they have pressure? Where do they have tightness? Where do they feel like they're holding their tension? You can have them do a real quick self-assessment on their own rotation through their shoulders or their own rotation through their hips. And then go through your fundamental program. Teach them how to align, so give them some cues to create more length in their spine. Teach them how to breathe. Give them cues how to get down into their abdominal breathing. Teach them how to get into breathing side to side. Teach them how to get a little bit of front to back. Have them put their hands on themselves if you're working in a group exercise class and you can't get around to everybody, and have them start to focus on their own body and increase their own self-awareness. And then teach them how to control this breathing as you take them through their program. So whatever fundamental movement patterns you have them do as part of their program, have them align breathing control throughout your program. So keep doing the things that you do that are already successful. Then right before you have them leave, have them reassess. They shouldn't lose range of motion, so have them recheck their shoulder range of motion and their hip range of motion. Have them recheck where they feel pressure and how they line up either on the floor or against the wall. And you should feel that they should feel that they're more even, they're more elongated, they actually feel more relaxed in their system. They maybe feel fatigued from the work you did with them, but they should not lose range of motion and they should not lose their posture or length during the workout. If they did, then something they did created compensations, and remember, that's the compensations and the loss of range of motion are signs that they have developed or gone back to those non-efficient strategies. So we want to make sure that our clients do not lose range of motion and or alignment at the end of the workout. So it's a really effective way to have your clients start self-assessing what's going on in their own systems, especially if you work in a group training environment. So, conclusion. In this webinar, we discussed the importance of evaluating and improving your clients' breathing so they develop a more efficient postural and movement strategy. By developing a new awareness, you can begin to pick up how improper alignment, breathing, and control can affect posture and function, and how by improving your client's ability to incorporate breathing into the fundamental movement patterns, you empower them to reach their fullest potential while potentially reducing the risk of injury. And we discovered that tightness is really a reaction to, you got it, inefficient strategies. Clients can gain efficiency, so you can really help your clients gain improved efficiency by applying the ABCs. A, alignment; B, breathing, that three-dimensional breathing we discussed; and C, control. Teach them how to align, breathe, and control throughout any fundamental movement pattern you take them through. And don't forget, ETR, earn the right. Teach them how to earn the right to perform at a higher level by teaching them to maintain that alignment, breathing, and control throughout their functional and fundamental movement patterns. Educate them about their posture and breathing, why it becomes so important, and then demonstrate on them how you can easily make changes in both posture, range of motion, as well as strength by teaching them how to incorporate the ABCs. And then always, always, always keep doing what you do so well as fitness professionals. Keep empowering your clients to become more efficient at everything they do. If you're looking for additional resources to help you serve the clients you are meant to serve, check out our website, fitnesseducationseminars.com. While the website was primarily designed as a resource for those of you who work with the general population, because our integrative movement system was designed based upon the principles of human movement, respiration, centration, and integration, they are 100% applicable to athletes and high-functioning individuals. We have over 100 free videos on our website on a variety of topics, including assessment, breathing, corrective exercise, developing and expanding your knowledge and skills so you become the expert your clients need, want, and will pay for. Sign up for our bi-monthly newsletter, Fitness Insider, as we are constantly sending you the most up-to-date information so that we can support you in your quest to serve those individuals you are meant to serve. I want to thank you for tuning into this webinar and hope that it has helped you remain informed so that you can become the expert your clients need and want. If you like this webinar and feel that it can be of help to others, please like it and pass it on to your friends and colleagues. This is Dr. Evan Osar of Fitness Education Seminars, providing you with the solutions and strategies you need to help your clients perform at their best and most efficient level. Looking forward to sharing with you at a future conference. Take care.